I'm Dr. Angie Stamm.
And I'm Kayla McGuire.
And this is Integrative Connections, a wellness community for pets and people.
Welcome to Integrative Connections. I'm very excited today to introduce Aimee Aquitania. She is a critical care nurse practitioner in Sacramento, California, and she's also my client. I treat her dog, who has intervertebral disc disease, little Frenchie, SD. She's precious.
Gosh,
and she comes in for acupuncture and laser therapy on a regular basis. She's very sweet. So that's how I found Aimee, and I'm really excited to share about all the different gifts that you have to offer and all your knowledge, particularly with your mobile wellness services that you offer with IV therapies, as well as bioidentical hormone therapy.
Well, thank you for having me. And I think one of the reasons I, gravitated towards your practice too is how you integrate, science with, holistic care and integrative stuff. So that's kind of what we started doing when we launched Wellness Mobile Services in 22. So we started mobile only, kind of post-COVID, meet people where they're at, home, office, did some events. And so as nurse practitioners with my other partner, we just saw just the gap that was really needed in integrative wellness, IV therapy. And so starting that business, obviously once we got a brick and mortar, we started the bioidentical hormones and really went, bioidentical is important. And, we can kind of talk about the difference between bioidenticals, why you'd want to do something like that. But it's also the delivery system that I use with BioTE, with the pellets, I really found was going to be the best for both male and female patients. I like that you don't have those peaks and valleys with the injections, creams, transdermals, they rub off, the efficacy is not as great. So BioTE really was the way to go. And I know you actually have a history with BioTE as well.
Yeah, my stepfather is an OBGYN physician down in Southern California, and he did the training, the BioTE training, I was doing it, I think, about 5 years now. And so he's been having great results with his patients. And so as a 49-year-old perimenopausal woman,
who looks fabulous, by the way.
Thank you. Thanks to you. Thanks to you. I started doing pellets about 1.5 years ago. Testosterone and estradiol, and it's made a huge difference on my own wellness, energy levels, and just general health. So awesome. I'm a huge proponent of it. And so I guess we could start off by going into the hormone therapy. Tell me a little bit about how you learned about BioTE, as opposed, and then why you decided to use that modality.
So I was working with a physician as an NP, and started in 21 actually, and was just learning about pellet therapy. I knew about the other ones, and then, went and got certified in 22.
Okay.
Early 22, and then, learned why, bioidenticals are so important. Things that are not bioidentical, those are the things that cause cancer. So I have patients, prospective patients that are like, if you do hormones, you're going to get cancer. And I'm like, okay, that is the mentality. And that's kind of what the mainstream media actually put out there a while back to kind of keep people from doing bioidenticals. So I love that, everything is plant-based. There is science backed behind all of this. And people that go on, and I've never had a patient say, I wish I didn't do this.
Can you hit undo? You can't really hit undo once the pellets are in, though.
No, but they just wish they would have done it sooner.
Yeah.
That's,
it's life-changing for a lot of people, for sure.
I've had men and women say it's saved their marriages.
Yeah.
They're, from brain fog, libido, energy, that sort of thing. And it's protective. A lot of people don't understand
cardioprotective,
bone density, muscle mass, it's not just, libido and that sort of thing. It's really quality of life and protection.
Right.
As we lose these hormones, as we age, we lose the protection. That's why women actually die of their heart attacks a lot sooner and earlier, is because the estrogen dips.
Right. And the estrogen is cardioprotective.
Exactly.
Yeah. And the testosterone is cardioprotective as well. So 100%.
For men,
yep.
There are people out there that don't know that women produce testosterone still.
Yeah.
And it's actually, it's very key for us. It's vital, it's
right.
with our muscle mass, bone density. So yeah,
I definitely noticed that I have, like more muscle strength with it. I wonder too with pets, I've thought with pets, like why aren't we doing hormone therapy, hormone replacement for pets? Most of them are spayed and neutered, so they don't have their own,
great point.
endogenous hormone, or they don't have the optimal endogenous hormone. So I wondered about, and I've talked to my dad about this actually, like maybe we could talk to BioTE about doing some, animal trials for particularly like geriatric sarcopenia. Why couldn't we use testosterone pellets for these geriatric dogs with like no muscle mass, right?
Yeah.
It's so safe. So
I love that idea. And again, I'm a total science geek.
Yeah, totally.
One thing about being a nurse is you're always learning, and I love, new things that come up. Science is always changing, right?
Yeah.
And if we just go back to the basics and replace what we're losing as we chronologically age, because we age 3 ways. We age environmentally, hormonally, and chronologically.
Right.
And, the thing with biohacking too is you can actually change your chronological age sometimes with, the things that we do.
Yeah.
So
the other thought I had with regard to hormone replacement in animals is we use, one of the things in the veterinary space is we use estradiol orally for urinary incontinence in spayed female dogs. So why couldn't we look at doing insertions of estradiol pellets? And then the owners wouldn't have to do the pills. Anyway, so
that's huge. I mean, Estee's had her little incontinence things too.
Right.
And of course, maybe it's like a UTI, but
Right.
her age, I think she's going to be 14 this year. So it's
so
like...
that sphincter muscle becomes weaker without the bladder sphincter becomes weaker without the influence of the estrogen, right? The tissues become more lax.
Right. I mean, that happens with us.
Yeah,
right?
Totally.
Kids or not. It doesn't matter. And a lot of women don't understand that too. It's like, this is not just because you had a kid's issue.
Right.
It happens kids or not.
Right.
It's the loss of estrogen.
Yeah. So who is the optimal candidate for starting hormone therapy?
So with women, I'll start there. Women, if you are starting to get hot flashes, you're noticing your libido is starting to fail, brain fog, kind of lack of energy. If you're noticing that your metabolism is also kind of just like in the tank and you've done all the right things first,
but you're still getting weight gain.
Weight gain, not sleeping well, brain fog, those are the things that lead me to. And of course, there's a questionnaire that, you've filled out too. And I always kind of put my patients through it. And it's not just to, get into your, personal space. It's literally like, this is what can help you.
Right.
This is our hormones are, some of the top threes that like everything, metabolism, sleep-wake cycle, everything, your skin. So I think starting, and it's not age specific, just like we don't chase a number with testosterone or estrogen. It's
how are you feeling?
It's symptom specific and symptom resolution.
So it could be as early as a woman in her early 40s, depending 100%. On her genetics and her
Yeah, so I usually ask too, like, do you know when your mom went into menopause? Those types of things. Also, do you still have your uterus? Do you still have your ovaries? I mean, if somebody had to go through a radical hysterectomy, had a C-section that went awry, blah, 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 they took my ovaries.
Right.
It's like, okay, you're done breastfeeding, you're doing all this stuff. If you want to feel like yourself again, you're probably going to want pellets, sooner than later.
Yeah.
And again, it's protective too, right? For men can vary so much. So I was working for another company doing hormones, but doing more like testosterone injections, oral or injection gonadorelin. So with men, testosterone therapy is actually almost like a sterilization technique.
Okay.
It stops their production of sperm. So if they're done having kids and they're experiencing the brain fog, lack of libido, lack of energy, that sort of thing, same thing, they go through their questionnaire, and then same thing, it's resolution of symptoms.
Okay.
I've had patients come to me and be like, I want to be at 900, 1100 testosterone. I'm like, no, you will not. No, you will not. So I tell people, I was like, look, I go after how you're feeling and how you're doing. Because once you get past, that, 900 to 1100 mark, you actually put yourself at risk for, heart attack, stroke, a PE, DVT, those sort of things.
So there's that happy medium that you want to
100%. And it's all about safety. My job as a nurse from the get-go, right off the gate, patient safety first, right?
Right.
I don't care if you have the libido of an 18-year-old if you're going to have a heart attack in 2 weeks.
Right.
So, it's really all about educating the patient. Be like, look, I want you to feel great. I want you to have great energy. good recovery in your workouts and have that vigor again.
Yeah.
But it doesn't do you or anybody else good if you're in the hospital. Yeah. So
you do lab testing prior, obviously.
100%. So we do pre-testing, and then BioTE has changed a little bit, and you probably know this too. It used to be, 2 to 4 weeks after your pelleting, you would get post-pellet blood work. Now what we want is a trough. So when you kind of drop off, we want to see where that leaves you.
Okay.
And then once we get you to that kind of like sweet spot, then it's just yearly labs. Unless, of course, something's awry, you get sick, you're in the hospital, you have surgery, stuff like that.
Sure.
But what I like about pellets is that evenness. It's, given by your cardiac output. So you don't have the peaks and valleys like if you were injecting testosterone.
Oh, interesting.
So,
I would think that actually with the pellets, you would have some, like, a peak when it first gets inserted and then it drops. Is that not necessarily true?
A little bit. You'll have a little bit of a jump only because that's a brand new pellet, but it's literally given off by your cardiac output. Okay. So depending on how sedentary you are, or how active you are, is how you're going to run through the pellets. And of course, men have a higher, but we also put larger pellets in men, that sort of thing too. But women run through their pellets anywhere between 3 months to 4 months.
Okay.
Men, on the other hand, again, depending on how active they are, go 4 to 6 months.
Okay.
So it's a much, I usually see men about 3 times a year. Women, it's 4.
About 4.
Yeah.
And again, you're going on the trough levels, but also on how they're feeling.
Symptom.
Right?
Yeah.
If you're feeling fine, you can stretch it out longer.
Exactly. And most women are usually a little bit more in tune with their body than men.
Yeah.
Just
really, you don't.
How it goes.
You don't say.
So women typically will notice before anything really, they're like, I'm not sleeping well.
Yeah, that was what it was for me. It was the insomnia.
I'm not sleeping well. My energy, a little more brain fog. And it's the little things that start. And then it's like, you better get in here. know? And so they're really good about it. God bless men, can't live with them, can't live without them. But they'll be like, I got to get in tomorrow. And I'm like, what were your symptoms? And how long ago did those start? Oh, like 4 weeks ago. And I'm like, okay. So, and I was like, but you're going to have that kind of 2-week lag time after these pellets go in, right?
So it takes a couple weeks for them to start
to kind of ramp up.
Yeah.
But so injection, peak, valley, every time you do an injection, right?
Sure.
And testosterone half-life is about 4 days.
Okay.
So you tend to inject every 3 days.
Okay.
If you want kind of that even number.
Okay.
So that's why a lot of people, and there are plenty of men that are like, I can't do the shots. And I'm like, I ain't doing them for you.
Yeah.
Like, you better find somebody else.
Yeah.
So that's the other thing. If you don't have somebody at home who can, stick you in a very large muscle group.
That's a lot of shots. Yeah.
It is. I mean, again, I've done IVF.
And the pellets are not that uncomfortable. I mean, you basically put a little bleb of lidocaine in the gluteus muscle.
Yes.
And then for men, you insert with a cannula.
Yep.
A couple, like an inch deep or.
Yeah, it's about, the trocar itself, inch and a half.
Okay.
And it doesn't actually go in the muscle. It slides right above the fascia of the muscle. So below the adipose tissue, above the muscle.
Okay.
Because it has to be able to move and slide.
But there's no sutures. It just, you just
no
put a little bandage over it for a few days.
Strips. Yeah.
And that's it.
Men have a longer time period for when they cannot do any strenuous exercise. That's 7 days, which some men are like, okay. Women, it's shorter. But no sitting in the jacuzzi, no lower body workouts. So no stairs, squats, lunges, that sort of thing.
Sure.
But that's once every, for men, 4 to 6 months. Women, once every, 3 to 4.
Considering, the inconvenience of having to do the injections.
Injections and
traveling and remembering to bring your injections and all that stuff.
100%. So I feel like the convenience part is huge. And I mean, for women, I'm like, great, I have a spa day today.
Right.
And, I have an excuse to, not have to do anything. And again, flat ground walking is totally fine. Like, you don't have to be a couch potato for, 5-7 days, but
no CrossFit.
No CrossFit. There's your excuse.
Okay. And then what about costs, rough costs for the pellets?
So men are usually 100.
800. Okay.
And then women is, I want to say, 475.
Okay.
Because again, I see men about 3 times a year, women 475. We are considering, depending on how BioTE works, at doing like a monthly fee, so then it just all is together.
Okay.
Then you don't have to have like that.
The big chunk all at once.
Yeah. So we are considering that, as we get busier too, just to help those people that, again, insurance doesn't love to cover bioidentical hormones.
Yeah. Not yet anyway.
Not yet. I'm hoping it comes to a point. There are HSAs out there, though, that will cover bioidenticals, and we do invoices for that.
I think I used my HSA for mine.
Yeah. So if you have an HSA, it has, Visa, MasterCard symbol on it, we can absolutely, invoice, BioTE, that sort of thing. Because, there are HSAs out there that will pay for your IVs, too.
Nice.
Yeah. So it just really depends on who your company is and that sort of thing.
Okay. And then what about risks or downsides for the pellets in general, and then or hormone therapy in general?
So pellet insertion, the risks are going to be, possibly, infection, rejection, possible a hematoma. I've never had an infection. I've never had a hematoma. I had one extrusion. Very interesting. And
like it'll pop out?
It'll pop itself out. Now, this gentleman is like, I'm still happy. I'm coming back for my pellets. And I actually have to send this pellet specifically back to BioTE because I want to have them check it out.
Oh.
He's like, it feels like plastic.
Oh, weird.
And I was like, really? And so I told him, like, save it. Please bring it back into the office because I want to send it. But he is still thrilled. He's like, I feel great, blah, blah, blah. And I'm like, okay. Whatever. But yeah, I've never had any of those things. And again, usually when I was working for the doctor, he had a cellulitis issue and it's like antibiotics. There you go.
Yeah.
But as long as you do good post-care, usually there's never any issues. As far as risks for hormone replacement therapy, risks are usually based upon dosing. So that's another reason why we don't want to give too much testosterone, too much estrogen, and that sort of thing too. So obviously too much testosterone is going to give you a thicker blood, H&H. So risk of heart attack, stroke, DVT, or PE for men. And then women, estrogen and testosterone. Estrogen, of course, we worry about cancers, uterine cancers, ovarian cancers, and breast cancers. If you have had breast cancer, it does not mean you can't have bioidentical hormones. It just means we need to know what kind of cancer, how you were treated, and then how far you are in remission.
Got it.
There are some practitioners that, after everything's done, remission, they're like, yeah, go for it. You're good. So it just really depends on the cancer, what type, how long you've been in remission.
Okay.
And we kind of go from there. And of course, it's a team effort. We talk to you. What are you comfortable with? We talk with, your oncologist, whatever, and say, okay, this is what we're looking at. We can start a very low dose. And that's another thing I like about BioTE is not everyone fits all for dosing. And you probably know this too. I start most people pretty moderately because I can always add another pellet.
Sure.
If they're not getting, the effects that they want, granted, is it another insertion, but it's, 5-7 minutes, right?
Right.
And it's just another pellet.
Sure.
I have been pelleted, so I know what it feels like. And I felt fantastic, but let's just go there. But, and that's when I was, with my physician, I cannot pellet myself. It does require
somebody else to do it.
Human to do it. But yeah, so those are kind of the things. It's a partnership between my patient and, their other provider, that sort of thing too. Okay. And then of course I tell people, women especially, if you're still in childbearing age or you are trying to get pregnant, that sort of thing, definitely clear this, with your fertility specialist and that sort of thing too, because that can definitely be known when you interfere with somebody else who's still trying to do those types of things.
Can there be temporary side effects on the initial, right after insertion, but in terms of systemic side effects? Because I felt a little bit nauseous sometimes from it for a couple of days.
Sometimes, yes, nausea or just feeling of you're getting all those hormones into your body, so your body can feel a little off.
Right.
To women and men, maybe some acne if you're getting a too high of a testosterone dose. Okay. Same thing with men. Now, I'm a huge proponent of supplements and vitamins when you're doing hormone replacement therapy. So like the DIM, super important. I think I did a TikTok and Instagram. I was like, if you are getting hormones and you're not taking DIM and your provider has not suggested this to you, they're doing a disservice.
BioTE actually
has the nutraceuticals. Yeah, that's what I use and sell in the office. And ironically enough, we're cheaper in the office than you are on Amazon.
Okay.
Okay.
Cool.
Which I thought was crazy.
So this is like a little vitamin pack that
Yep.
they make that's specific to support the hormones.
100%.
Right.
So men, if they have too much high testosterone, it aromatizes into estrogen.
Okay.
So we're talking like man boobs, acne, a little more emotional than they probably want to be. And then, you know, women, of course, we're just sometimes just labeled a little crazy if we have a little too much estrogen.
Or not enough.
Or not enough. Yeah. It's the perfect balance, right? It needs to be in harmony. So those are usually the side effects that we see. I can prescribe stuff for the acne and that sort of thing too. But, you know, I make notes like, okay, we probably need to put you on either, you know, an estrogen blocker or adjust your testosterone for your next pelleting.
Okay.
Along with, are you taking the DIM? Are you taking the ADK? So there's a NutriPack boxes that has, you know, the 3-pack, so you can just take it daily with you. They're super convenient. Or just the DIM, which is like 60 in a bottle, and you just take that.
Okay.
And even if you're not on hormone replacement therapy, DIM is fantastic for the perimenopausal
Okay.
for balancing.
Great.
And it's also cancer fighting.
So DIM is diindolylmethane,
Yeah.
which is a concentrate that is from cruciferous vegetables.
Yeah.
And it binds the bad estrogens.
Exactly.
So it's not that it's blocking the estrogen that you just put in the body. It's blocking the bad form of estrogen that your liver makes as a byproduct of
Exactly.
of processing it, correct?
Yes.
Okay.
And what's very good too is when you maximize those detox pathways in your liver, that prevents the, you know, aromatization of excess testosterone or estrogen. So it just helps you balance the hormones.
Okay.
Yeah.
Okay.
Helps your body be more efficient with them.
Okay, good to know. So, great. Well, let's move on now to your IV therapies that you do. I know you do mobile and in-clinic intravenous therapies
Yep.
of various types. Do you want to kind of just walk us through the different kind of menu that you offer?
Yeah. So I'll keep it super simple because, I mean, we have several things to offer. We utilize Liquivita, which is a 503B that's actually out in Florida. They have their own, you know, pharmacy that does these, but they've been in business for quite some time. And the reason we went with them is for quality.
Okay.
That stuff comes to us shipped cold overnight. It's kept in a refrigerator, always packed and ready to go. One thing about California too is obviously they're very strict. We know what Californians like to have a business here.
Right.
We don't compound anything. Compounding is actually a no-no unless you are an MD here in the state of
So
California.
you've got to get it direct from the manufacturer, shipped in. Mm-hmm. Okay.
There are, you know, some other providers here in, you know, California that, you know, all their vitamins that they put in IV are sitting on a shelf at room temperature. That is not what we do. So I am big on quality. Yes, does it cost us more? For sure, but our patients feel it. They know it, and I think that's very important. Okay. So we use Liquivita. Their signature IV, which I love, it's my favorite IV. It's like our top of the line, unless it's an NAD, is Fountain of Youth. Okay. So that has all your B vitamins, calcium, magnesium, gluconate. It also has 15,000 milligrams of vitamin C.
Nice.
And then 2,000 milligrams of glutathione. And glutathione is our body's master antioxidant. Mm-hmm. So we lose the ability to produce as much, replace it as we age, and it's amazing for skin.
Is that similar to like a Myers cocktail? Is that what they call a Myers?
Yes and no. The Myers is more just, you know, a little bit of B, some C, and like magnesium.
It's smaller. It's not as high dose.
Right.
Okay.
Right. And a Myers, a lot of people, I feel like that's like the entry level IV. If I can say that.
The starter IV.
Yeah, it's a starter IV. And usually a lot of people love that for their hangovers.
Okay. Okay.
So that's kind of...
Why wouldn't you go higher if you could?
100%.
More is always better. No.
Yes. Well, and anything, a lot of people worry about overdosing on an IV for certain things. And your body will utilize what it needs. And of course, your pee's probably going to be bright yellow, you know, for a lot of things. So obviously vitamin C is, you know, water soluble.
The B vitamins make your pee brighter.
Exactly.
Yeah.
Exactly. So Fountain of Youth, and then we have the Rise and Shine, which is kind of like our hangover cocktail. So all your B vitamins, magnesium, gluconate, calcium, and then we sometimes will do like a Zofran if they're nauseous.
Okay, nice.
Or if it's later in the day and they're at home, we'll give them Benadryl.
Okay.
Also helps with stomach issues as well as sleeping better, because the GABA rebound for a hangover too, you didn't sleep very well. So that kind of really helps with that.
And are the bees, are they methylated bees?
Yes,
Okay.
always.
So talk to us about what that means.
So, what is it? 50% of the people don't have the ability to methylate, their B vitamins. So
turn it into the bioavailable form.
Exactly. Yep. And it's a gene that a lot of us have, and you have to do the testing to know.
Right.
So we just always do
methylated.
The methylated. Just it's way better, and everyone can utilize it, right?
Right.
Same thing with our shots. Same thing. We always use methylated.
Okay. So you do intramuscular injections.
So we do B12. Obviously we can do B complex too, but everything we do is methylated for the shots.
Okay.
And the last kind of IV that I love to give and tell people about is NAD, and then pairing it with Pico IV.
Okay.
So NAD has gone huge in the last probably year and a half, 2 years. We started doing it in 2022 when we launched, and a lot of people, it still wasn't really in there. And I actually started using it for fertility.
Okay.
Because there was, scientific space, it's anti-aging, rejuvenative, that sort of thing. And it is incredible, for brain fog, helping, repair mitochondrial DNA. People really feel the difference when they are doing it.
But that can have some side effects when it's IV, right?
Yes.
It can be a little harsh.
The NAD IV is probably one of the most painful IVs you could ever do.
Yeah, I've done it once, and I don't know that I'll do it again. It was awful. It was awful.
Yeah, no joke. No joke. It is not for the faint of heart. So
it makes you feel kind of nauseous,
all the
uncomfortable.
Things. So you can get heart palpitations, headache, nausea, stomach cramping, muscle cramping. I mean, it's no joke.
You feel like crap, basically.
You do.
While you're getting it.
While you're getting it. Afterwards, and the weeks later, it's, energy, the brain fog clears, your recovery is great for your workouts, but it's pretty brutal. But what we actually found now with Pico, with a 5-to-1 ratio, the side effects are almost cut in half.
So tell us, what is Pico?
So Pico is the world's 100% THC-free CBD infusion.
The first injectable CBD product.
Yes.
So they figured out how to sterilize
CBD
so that it can be given intravenously.
Yep.
Super awesome. And so this is obviously derived from cannabis, but it's not psychoactive. There's no THC in it. So you have all the medicinal anti-inflammatory benefit of the plant, but it's sterilized and you're able to give a very high dose intravenously without going through gut absorption, which is not very efficient.
Exactly. Okay. Well, and if you don't have a good gut, you're going to lose a lot of stuff too. So people that take vitamins, and one of the reasons we do intravenous is so you bypass that first pass, right? The metabolism of the gut.
Right.
And so Pico really helps with so many things, but we are also knew a lot of that, but we're like, let's pair it with something that's just incredible, but also painful to do.
Right.
And so we did...
you stack the Pico with NAD.
Yep.
And then now what are you getting?
So you're getting Pico...
Are they getting less side effects?
Yes. Nice. Less side effects and decrease of how long you have to sit there.
Okay.
So we did...
You can flow the NAD faster without killing, not killing,
this poor patient, your patient. Right? Yeah, feel like I'm gonna die. Yeah. So the 5-to-1 ratio has been kind of the best thing.
And 5-in-1 is what exactly? That's all the different fractions of the cannabis.
So
plant?
Just the 5-to-1 ratio between how much NAD you're using and Pico.
Oh, got it.
Yeah.
Okay.
So
5 parts NAD to 1 part CBD.
Yes.
Got it.
And so we did 500 milligrams of NAD, and we only did 100 milligrams of Pico.
Of CBD. But that's a lot of CBD.
Yeah.
Because if you think about what you would take with an oral CBD, you might take 5 milligrams, and then you're only absorbing 10% of that. I think the oral absorption is only 10%. Whereas the IV absorption, so you're blasting a huge amount of CBD with the IV.
Yes. And I've been able to do Pico by itself, and know what I feel like, with just Pico, which is, usually relaxed, a little focused, but you don't have, any really side effects with Pico.
Okay.
So you know exactly what the NAD side effect is. And people that have done NAD like myself, I did an NAD with Pico and was able to do it in less than an hour and a half, when normally I'm at like 2.5, 3 hours.
Okay. But still, that's a long time to sit there.
It is.
Infusion.
And a lot of people don't have that time.
Yeah.
So,
but the benefits are going to last you how long?
So NAD infusions tend to last at least 2 to 3 weeks, I think, for good side effects, right?
So it might be something to invest in if you're like going to go on a trip and you want to feel amazing, right? Or you're going through a big work crunch, or
100%. The other thing is too, is if you're dealing with any chronic issues, NAD and Pico both do incredible things. The Pico helps with, anti-inflammatory, insomnia, anxiety, chronic pain issues. I've had patients that have IBS or ulcerative colitis that this will actually help them better with their flares than other things.
Amazing.
Yeah.
I mean, I don't know why we're not doing this for pets.
I would love to see that for pets.
I would imagine, though, that with NAD, I guess, with NAD, you can explain to the dog that, why
this is going to hurt,
why you're so uncomfortable for the next 2 hours.
Yeah, for sure. I think they definitely tolerate Pico way better.
Right. Well, I've actually tried Pico in some pets. I actually was approached by by Dan. Dan, who works for Pico, had a dog with a terrible tumor on his nose, and he came to me. Because he wanted to try the IV CBD to treat the cancer, and we actually had some interesting and sort of challenging side effects from it in the dogs that we tried it on. A lot of itching, a lot of kind of like histamine type reactions.
Oh, okay, like mast
facial pruritus, erythema, ventral erythema, redness, itching. And so Dan explained to me that was on their original product. Now it's a full broad spectrum. So now it might be a little lesser, but it may be that the pets metabolize it a little differently. Maybe they need a different dosing. We're not quite sure. And also the veterinary medical board is a little bit, this is in the gray zone in terms of what veterinarians can legally be giving to their patients. They look at this as still in the cannabis category. So, which is really unfortunate because it really is an amazing medicine.
100%.
And pet stores can sell CBD tinctures, but the veterinarians can't. So go figure. The herbalists can't sell the plant-based,
I think
medicine.
That's crazy.
It's so hopefully that will be changing, but anyway, I think that there's potentially some benefit for pets too. And I know that when I was working with Dan, he put me in touch with some human practitioners out in Florida who were treating cancer with very high dose IV CBD with really good success.
Yeah, well,
I mean, they're stacking it with other things.
Right. But it's adjunctive product, right?
Yeah.
But with cancer, and of course it's a terrible disease. I just lost my stepfather this last January to cancer, and it's horrible, right? Horrible. And the side effects of cancer, just between the nausea, the pain, all of it.
Yeah.
And so Pico kind of helps quell a lot of that, even the anxiety, everything that you kind of go through too. But there's some incredible research that CBD, like the CBDA, the CBDG, are doing things to cancer cells and killing things that even chemo, which kills a lot of other good things in the body, is doing. So,
and it's antimicrobial too.
Yeah.
Which is really interesting. And you think about cancer usually has a bacterial component to it, right? Because of the killing off of the tissues around the tumor cells and the bacterial colonies. So having that sort of antimicrobial effect is sort of interesting, right?
Yeah. I mean, I know too, they're, still in first stages, but Pico's going to be going after Pseudomonas.
Interesting.
Yeah. And I mean, I've witnessed Pseudomonas
in the ER,
in the ICU. I don't know how many times. I mean, that kills people.
Yeah.
So I'm still praying for, a broad spectrum. Like if we can use this as a broad spectrum antibiotic at some point, and it's not an antibiotic, it's not going to ruin your gut.
Right.
It's not going to give you the systemic side effects that, our broad spectrums do. I mean, when I prescribe an antibiotic, I got to look, what is their kidney function? What is this? What other, things are they taking? I mean, we can't find anything that this really can't go in with or work with.
It's extremely safe.
Yeah.
Yeah. Now, can this be given, it's labeled for IV, but can you give it as an intramuscular injection?
So I have seen people do IM and sub-Q. I have not done it personally. I think like some MMA fighters have seen it.
I tried it in some dogs.
Oh, okay.
As an IM.
Yeah.
Just because it's a little faster and
less traumatic.
We don't have to put an IV catheter in and torture them.
Sure.
So for cancer patients, when Dan brought me some samples to try, it seemed to work.
I would say, an IM for a pet would be fantastic.
Yeah.
Again, for anxiety, pain, all of those things. We just haven't done it in humans as much, only because we wanted it specifically, I think, just for IV.
Sure. So veterinarians out there who are kind of curious to try it maybe on their own pets, even though it may be in the gray zone of what they can use for their patients.
Right.
Maybe if they have their own cancer patients they want to try it on, they could reach out to Pico and they'd be happy to give them some samples.
Yeah.
Because they're really, I think they're, from speaking with Dan, super interested in collaborating with veterinarians.
Would love that.
They would love to try to emerge into the veterinary market as well.
100%.
Right?
Yeah. I mean, I feel like this plant and this product itself could be revolutionary for health.
Yeah. I mean, that was really profound. And so you have clients coming for just Pico too, right?
Yeah, just Pico by itself.
Yeah.
Whether in office or home. And the home patients, usually I do like an afternoon, evening, and they're like, oh man, we slept through our alarm. This is great. And this is just, with a 25 milligram dose. That's what I start people out at.
Okay.
And you tend to go up 25 milligrams at a time.
Okay.
We actually, ironically, don't have a quote unquote max dosage.
Okay.
I know the CEO and a couple other people have gone up to, 100, 200 milligrams of it.
Okay.
But,
And that's what you're stacking. You're putting 100 into the NAD infusion.
Yep.
Right?
Yeah.
Okay.
So I think what's nice about this is it can be customized to what the patient already has a threshold to.
Right.
If you've been using CBD, you've been doing gummies, you've been doing tinctures, you're probably going to be fine at a 50 milligram dose, right? Sure. And again, there is no euphoria or that sort of thing, but you do feel something, if that makes sense. I know it's kind of hard to
It's more like a relaxation feeling.
You feel super relaxed. For me, I feel relaxed, but I'm focused. Like I can do some work. I am like, my ADHD is bad just as a provider, but it's like, I can really get some things done.
Okay.
So yeah, I really love the side effects of it.
Sure.
And then of course I do sleep like a baby at night.
Sure. Okay, great. What would be the most profound, can you give some sort of testimonials or kind of case examples? I know there's HIPAA laws and all that, but maybe in general, what would be the most profound healing effects that you've seen from your different IV therapies that you have, other than of course their hangover and energy and things like that, but I'm sure that there's other more profound examples that you see.
So, with NAD, why I'm such a huge fan of it is because it can help with so many things. So NAD actually has also been used for detox purposes.
Like heavy metals,
drug detox, alcohol detox.
Okay.
It actually really helps reframe and readjust chemistry in the body and in the brain.
Okay.
Because
for somebody who's trying to get off alcohol or drugs.
100%. So there is a good protocol, that we load, every other day, and then it's once a week, then once a month, and it really resets the body chemistry.
Okay.
And again, you're also getting the repair of the mitochondrial, you're clearing brain fog, the GABA receptors kind of just rebalance themselves.
But it's all done outpatient.
Yeah.
Which is awesome.
Yeah.
Yeah.
So say somebody is like, I'm not checking myself in anywhere, but I know I need
to reset.
Help. I've got an HSA here. Yeah. Let me figure this out.
Yeah.
So NAD is fantastic for that. Okay. Of course, Pico, I've seen, same thing with chronic pain, anxiety, insomnia, that sort of thing.
Can you talk to me a little bit more about the NAD and heavy metal detox? Are there certain lab tests? How do we know if we have a lot of heavy metals and NAD would be a benefit for that?
So,
we probably all have a lot of heavy metals.
100%. Well, we were cooking in aluminum for a while, all kinds of, whatever, environmental stuff. So, NAD is great for detox in general. There's also EDTA.
Okay.
Which
and you do that as well?
We do. However, the state of California doesn't want us to.
Okay.
Go out in Nevada lines and we'll be fine.
See you in Reno, girl.
Yes. So you may not know this, but so the Board of Pharmacology is trying to actually take off NAD, glutathione, and vitamins for parenteral infusion because, again...
In California?
And so
but not in other states necessarily.
No,
okay.
it's just
California.
here. And so I think I have shared this on my story too, but yeah, there's another thing with the Board of Pharmacy that they want to take NAD and glutathione off the market. Like you cannot get it.
Okay, and the reason they're saying for that is?
Basically because us as practitioners don't have a specific, kind of like, you know, how you write a script for metoprolol.
Right.
Blood pressure, blah, blah, blah.
There's no specific diagnosis for the treatment.
Yeah, but like, you know, our firefighters down in Southern California, they needed glutathione, you know, nebulized, you know, to help, you know, their lungs.
Sure.
NAD is, you know, clearing things, you know, detox heavy metals. And of course, anyone, you know, doing hazmat stuff, you know, fires, that is life-changing for them. Firefighters have the highest rate of cancers because what they're exposed to.
Yeah.
And that's across the country. But yet our state is trying to pull some of the most, you know, valuable things to prevent things like cancer. So yeah, Bob is not my friend right now. I swear I'm going to be a target. That's okay.
And what is for the non-NAD IVs? What's the time frame and cost for something like your Hangover? You know. So
IVs typically, unless it's something like NAD or something extensive or large volume, is going to be about 30 to 45 minutes.
Okay.
You know, and depending on how dehydrated you are, I've seen people suck down bags and very, very quick time. But, you know, we always start everything off slow, make sure, you know, the site is comfortable, that you're comfortable. And then, yeah, usually about 30 minutes. Pico is started off slow for the first 5 minutes too, to, you know, assure that you're not going to have a reaction, anything like that. I've never had any reactions with this guy. But yeah, it's just start slow, see how you tolerate. And then, yeah, most IVs 30 minutes.
Okay.
Unless it's NAD.
And cost range?
So our Fountain of Youth, which is like my premium, my favorite, is $475.
Okay.
And then Rise and Shine, our Hangover, you know, I want to say is $275.
Okay.
So, you know, it ranges, you know, depending on what, you know, you need. And of course, sometimes we will add NAD to a bag or, you know, Pico. So there's some things that you can add, obviously, unless they're, you know, contraindicated.
It's all customized.
Yep.
And then the benefits are going to last anywhere from a few days to a few weeks
usually
or longer.
most people keep their IV good side effects, I would say, for about 2 weeks.
Okay.
Yeah. They can usually fill them. And then people are like, oh, I'm ready for another one. Especially those people that are, you know, the go-getters, have 3 jobs, or traveling back and forth between, you know, timelines.
Sure.
That sort of thing too. I mean, that is hard on the body.
Sure.
And I mean, I know a lot of people probably don't think about this, but think about what you're exposed to when you're just sitting on an international flight.
Right.
You know, radiation in the airplane. I mean, all the things.
Yeah.
So I think a lot of people don't understand what that puts your body through.
Sure.
And I love traveling, but it can be rough on the body, right?
Yeah. Do you take your IVs with you when you travel?
I have. Problem is trying to cannulate yourself is the hardest part. So unless I'm going with somebody who's licensed, that can be a little hard. But no, when I was doing last year, I was filming Beta Blocks, which is like the entrepreneur competition that I did. Wes Bergman was like, did you bring your IVs with you? I'm like, I am not licensed in the state of Oklahoma. Otherwise, I probably would.
Otherwise you would?
Yeah.
Cool.
And that was a fun experience.
Cool. Where can patients access, if they're not local to Sacramento, where could they access the Pico IV?
So you can actually go on a provider like site. So go to picoiv.com. Okay. And, you know, they just type in basically where they're at and they can find a provider for Pico. That's a really great site, by the way. As far as, you know, here locally in Sacramento, I'm just, you know, one of 3. So my office is inside Total Beauty Experience on Arden Way. Okay. And then we're also going to be going into Whole Self, doing IVs and shots.
And tell me about, what is the Whole Self?
So Whole Self is a biohacker's heaven, so to speak. So they have a cryo chamber, a PEMF bed, and red light bed. They have a room that has cold plunge and sauna in it too, so you can go back and forth. Nice. And then the IV lounge, they do compression as well as, it's a beautiful space. It's like a sanctuary. You feel like you're put out into, Tulum with, the fountains and the water. And it's super duper quiet. It's right on the corner of Fair Oaks and Watt. And it's just a lovely space. You just feel like you're transformed, and it's quiet. So you can get your IVs while you're doing your compression therapy. You can make an appointment, or if you already have, a profile with me, you can just come in for shots, walk in. So our launch there is the 21st, but we'll be there weekly on Tuesdays.
Nice.
Yeah. So I'm super excited. I still need to do a circuit, is what they call it. So you'll come in, check in at the front desk, and you'll do, whether you want to do red light, the PEMF bed. They offer facials there too. So it's a lovely space.
Awesome. Tell us a little bit about, do you have much experience with PEMF?
I've only been able to sit on one. I know you probably had some really great experience with it, but I mean, I hear such incredible things from people like surviving cancer, going through chemo. So I'm super excited, to get more experience with it.
Totally. Yeah.
What have you experienced?
So I was introduced to it by actually my dad, who's an OBGYN down in Southern California. And he has been using it with his patients with chronic pelvic pain and cystitis issues. And my mom, who is a type 1 diabetic, he ended up buying one for her to use because it works on the microvascular system. And that's what the problem is with diabetics is, microvascular disease. So she's been using it religiously for like 2 years, and she feels amazing. She she notices it when she doesn't get on the mat. So it is.
That's incredible.
Really,
and how
really
often
awesome.
Is she going on the mat?
Every day, religiously every day.
Okay.
8 to 20 minutes a day. Sometimes she'll go on twice a day if she feels off. There's different programs that you can do, but really it's just working on blood flow and mitochondrial function, right? It's recharging the mitochondria, and then everything else is going to work better in the body, right?
Right, because you do mitochondrial repair, and it has a trickle-down effect.
Right.
So yeah, that's another reason why I think NAD is just so incredible.
Absolutely.
Is,
and it's probably synergistic with the PEMF, right?
100%, 100%. So people that, have chronic issues like, type 1, that's huge. So I love hearing stuff like it's not just for one or two things. Like anybody can use this technology to feel better, sleep better, all these things. So that's why, I was huge too.
Yeah. You should put your IV patients on the PEMF mat while they get their infusions,
and
then they'll get kind of double whammy.
We totally will do that. We actually had a patient at A4M when in December, and this guy brought his mat while he was doing his Pico, and he's like, "I swear by this," and I was like, "Hey,
that's
more
awesome.
Power to you."
Yeah,
Stack them up.
Great. Well, thank you. Where else can people find you? Patients find you? Is on your Instagram?
Instagram is at Wellness Mobile.
Okay.
The website is thewellnessmobileservices.com.
Okay.
My personal is Aesthetic Aimee, ACNP on Instagram. But and you can always, our phone number is textable. So it's a cell phone, so you can text or leave us a message.
Awesome. All right, well, thank you for joining us today. It's great chatting with you.
Ditto.
I'll be signing up for an NAD Pico soon.
Oh, you'll love it.